All right, welcome. Thank you so much for joining us. This is Joe Valenzuela with Vista Mutual Insurance Services, and today we're going to talk about Medicare Advantage plan types. There's a lot of different jargon when we talk about Medicare insurance or insurance in general, and this is just to try to help you understand the types of Medicare Advantage plans a little bit better for you. So Medicare Advantage plans are incredibly important. They were brought about in 2007, and the main reason was because Medicare supplement plans still had underwriting, meaning that people could be asked questions about their health and denied coverage or a waiting period for their coverage. Medicare Advantage basically stated that no matter your health condition, you can come onto a plan during a specific enrollment period, and they're a lot less costly per month for people. So let's talk about the main types of plans. There are more than this, but we're going to go over the main types of plans that are available in the Medicare Advantage world, or Medicare Part C. They're interchangeable words. First, we're going to start with an HMO plan. This stands for Health Maintenance Organization, and these plans were designed to lower costs and coordinate your care. So usually if you have an HMO plan, you have a list or a network of doctors that you have to stick within. You also have to get a referral in order to see a specialist. So there can be good and bad things about this. HMOs have a lot lower cost usually because they're able to contain the cost. You do have to see that network of providers, right? And you do have to get a referral. So those are some cons there. Now, usually though, that's how most people use their healthcare. They go to their regular doctor, their normal internist, and then if there's an additional issue, they ask them about that and get a referral to another doctor. So even if you don't have an HMO plan, this is usually how things work. So HMO has a group or network of doctors that you must stick within. You have to have a primary care physician, and you need a referral to see a specialist. Those are the basic tenets. They usually have a lower cost too because they're able to contain those through the contract. All right, let's talk about a PPO plan. Now, PPOs are different than HMOs, obviously. It stands for Preferred Provider Organization, and they give you a little bit of greater flexibility when choosing your providers. So you do not have to have a primary care physician when you have a PPO plan. Now, not to say that you wouldn't want to or that most people still don't have one. You just don't have to have one assigned to you. So there's people that live in two places that are snowbirds, for instance, that live in an area that's relatively good during the summer, and then when the winter comes, they go to another area that's more advantageous for them weather-wise. So if you're one of these people, a PPO plan might be a good option for you because you're able to get primary care outside of your service area, in other states and other counties. So if you have one place you live 6 months out of the year and another place you live 6 months out of the year, it might work for you to have care in both places just like you were in your home state. Now, even with an HMO though, with an emergency or urgent situation, you can still get care outside of your area. But with the PPO, you're able to do that regardless of if it's emergent or urgent. Now, you do not have to have a primary care physician, although most do again, but you also don't have to have a referral. And that's what a lot of people like with PPO plans, that they have the option just to go to see a doctor without talking to their initial doctor, or to see a doctor that they really want to see outside of their doctor's referral or recommendation. So it's great for people that want to do that, for people that live in both areas, but you're usually going to have a higher cost associated with these plans, not only for the premiums and co-payments that you're going to use, but also when you use them out of network. So a preferred provider organization, PPO, does still have a list of preferred providers that they want you to use. And sometimes this is a larger list or a national list, but they prefer you to use those. And for doing so, you're going to get much lower cost. If you step outside of that list, you're going to get charged with an out-of-network cost. Sometimes it applies to deductibles and usually a higher cost, or sometimes even a percentage of the cost and not a set co-payment. So there's where PPO plans are good for. Let's talk a little bit about SNP, or Special Needs Plans. Now, these plans are tailored for specific conditions. They do have limited availability, right? So not all plan types are available in all areas of all the plans that we're speaking about today. So you have to talk with an insurance agent or go online to see which plans are offered in your area. So with again, special needs plans tailored specifically for a subset or group of people, and it's usually tailored to treat either a condition or due to the fact that you have limited income resources. So there are two main types of special needs plans. One is a DSNP, which stands for Dual Special Needs Plan, and this is designed for people that have Medicare and Medi-Cal. If you have both, they coordinate together so that you have very low or no cost to pay. But these plans are designed to give you additional benefits on top of what Medicare gives you to help you out. Things like transportation, things like over-the-counter coverage or gym memberships. You'll still get everything for zero cost, just like when having Medicare and Medi-Cal, but this just gives you sometimes larger networks and more benefits. Now, the other type of special needs plan is a chronic special needs plan. These are designed for a specific condition. The one we see a lot is a diabetic chronic special needs plan or a heart condition chronic special needs plan. Now, these plans usually have lower copayments, lower premiums, higher ancillary benefits, and again, are tailored or designed to specifically treat that condition. So diabetic, for instance, you're going to get test strips, Lancets, and glucometers for no cost to you. You're going to be able to go to diabetic education classes. They might even have a meal benefit included to help you jumpstart your healthy eating. So that's what special needs plans are. You also have MSA plans, M as in Mary. And what these are is medical savings account is what it stands for. And it's a high deductible plan with a tax-free savings account. So basically, you get a high deductible plan and they put a little bit of bucket of money into an HSA account for you to spend on your healthcare expenses. There's specific rules for these plans. They're not offered in many areas, but they do work for some people, especially in rural areas. Okay, let's talk about private fee-for-service plans. These plans are almost non-existent in California now. There used to be a lot of them. And what you really, really need to understand with the private fee-for-service plan is that a doctor can accept the plan whenever they want, meaning they can accept it and they cannot accept it, which is good and bad for you. They have to accept the plan's terms and conditions for payment each and every time that you go in. So people get a little bit scared with that because, yes, any doctor can choose to build a plan, but also any doctor can say, nope, we're not taking that anymore. So it works, again, in rural areas. Now, a lot of these plans that we talked about right now do have a Part D plan built into them, and there are some that do not. So private fee-for-service plans do not have to have a Part D benefit built into them. And also MSA plans do not have a Part D benefit. You have to get that separately. Okay. What you really want to do when looking at all of these plans is kind of get in your own mind what is most important to you. Now, you never want to pick a plan just on, one little benefit or one plan type. You want to look at the overall picture and make sure that you're getting a good cost for good value. But you do want to look at what you view as health insurance. If you're currently in an HMO type policy and you're okay with having a primary care physician and getting a referral to see specialists, and maybe this new plan that you're choosing already has the same network of doctors that you're using, then an HMO policy would work great. If you're currently in a PPO plan and you like the way that works, and you have doctors that are in different counties and different networks, different states, then that plan may work for you best. So it's not a good, better, or best here. It's what is best for your individual needs on an overall basis, right? And this is where we can come in. As agents, we live and breathe this stuff every single day. We are constantly comparing and contrasting plans for people, explaining the benefits so that they can make a good decision. We don't really sell things in our industry. We represent a variety of carriers, so we inform you about those carriers so that you can make an informed decision about what you want to do with your healthcare. You can reach out to us at any time at vistamutual.com. We're Vista Mutual Insurance Services. and we can help you. There's no cost associated with working with a Medicare insurance agent or broker. If you decide to enroll in a product, then the insurance company pays us to do that for you. And we service you throughout the lifetime of your contract with free lifetime claim support. And no money comes out of your pocket for this, right? The insurance company pays us, and it is the exact same no matter which product that you pick in the Medicare Advantage world, so that we don't create bias. So thanks again. Thanks very much for joining us today. Hopefully you're getting some great information and tips from these videos. Join us again next time when we talk about the wonderful world of Medicare and all the complexities that exist within it. For Vista Mutual Insurance Services, I'm Joe Valenzuela. Thank you very much. Have a great rest of your day.